Hi, I'm Ayla Hamidovic from Bosnia and Herzegovina.
This is Anish Sarkar. I'm from Bangladesh.
This is Shia from Canada.
My name is Davina and I'm from Australia.
My name is Maria Shaldina and I'm from Russia.
My name is Elton Olur and I come from Kosovo.
I am Grace Greeny and I'm from Zimbabwe.
I'm Siwa from Malaysia.
Hello, I'm Bella from Sierra Leone.
COVID-19 has taught me the importance of thinking creatively when practicing medicine. For what we're seeing across the globe is irrespective of whether you're practicing in a low, middle, or high-income country, we're all coming up with creative and innovative solutions to address the needs of resource availability.
After working as a doctor during the COVID-19 pandemic, I have learned that we as medical staff can be very effective and adaptable when needed.
One of the most important lessons that I've learned during this COVID-19 pandemic is how fast, efficient, and adaptable countries can come together to help share safe practices and overall help strengthen each other's healthcare systems.
The COVID-19 pandemic taught me that both as future healthcare professionals as well as human beings, we can easily develop such a strong sense of adaptability and mutual compassion.
One thing I've learned is cost-effective and timely interventions are of paramount importance in times of such crisis.
I've learned that it's essential for all hospitals to develop surgical response plans in advance and to update these depending on the course of the COVID-19 pandemic.
My lesson about COVID-19 is emergency C-section services are on the decrease due to pandemic.
Due to COVID-19 pandemic, there is a strain on the healthcare system. Surgeons have witnessed a change in their practices with the rapidly decreasing elective surgery.
One thing that I've learned from our fight against COVID-19 is that everyone has to be involved in a fight against a pandemic. That is from the healthcare professionals to the leaders and politicians, as well as the general public.
It affects all ages. It does not choose whether you're an infant, whether you're an adult or an adolescent. It just affects all ages.
Even when some healthcare professionals have to stay home during the COVID pandemic, there's still a lot that can be done to help and fight for the cause.
Through this pandemic period, I've learned that there is no small goodness. Everything that you've done to help the others is important. Remember it.
It doesn't really matter if you're a medical student or a surgeon. We all have a role to play in this pandemic.
Everyone, everywhere has a role to play in this pandemic, especially the sharing of trusted information.
Medical students can actually work in the front line and they shouldn't be underestimated.
One thing that I've learned about global surgery in the COVID-19 crisis is how important it is for the surgical community to help out our colleagues on the front line. Together we can do so much.
I learned that surgeons can never stop doing their work, even if the whole world stops, because there will always be patients who need surgical care, no matter what the circumstances are.
I learned that anesthesiologists and critical care medicine specialists should be different for different healthcare facilities. Thank you.
Health professionals should be given more credit than what the society gives them.
There's no one healthcare system that is complete without everyone being covered, and the same thing applies to safe and affordable surgical care.
We cannot beat this COVID-19 pandemic without surgical facilities.
Stay safe with uninterrupted safe surgical facilities.
Operating theaters must be fumigated after each surgery.
Surgeons and healthcare workers involved in preoperative care need to improve staff and patient safety, whether or not there is a pandemic.
The main focus of all healthcare systems should be in providing a safe and effective surgical and anesthetic services.
It is important for all hospitals, including smaller but proximal ones around communities, to improve surgical services, recruit personnel, develop protocols to enhance accessibility, limit travel during these pandemics.
Patient undergoing any surgical procedure must be evaluated by lab test or clinical diagnosis of COVID-19 infection.
People who need surgical treatment having symptoms of flu should be kept in a separate cabin rather than in the ward with common people.
The pathology of COVID-19 is affecting the vascular system. There are a lot of complications like a deep vein thrombosis, like a thromboembolisms, and etc.
Proper personal protection must be ensured for all the surgeons before touching the patient or even entering the operation theatre.
The most effective way of controlling the virus is washing hands with soap and water, a scarcity of which will be a disaster and a crisis in the future.
The health facilities are not really having kind of a sanitation, that they are not focusing on wash, hygiene, sanitation, and water supplies.
It took us a pandemic to understand the flaws in our healthcare system, and now it's high time for us to understand that health is indeed a global issue and everyone has to play their part diligently in achieving UHC.
Health is a global and all of government issue.
The Sustainable Development Goals are connected to one another, and COVID-19 has affected every goal of the SDGs and Sustainable Development Goals. We have to accelerate the SDGs and we have to take it seriously.
The most important aspect of our social well-being is effective and collaborative investment in our healthcare system.
We need more transparent labor laws which facilitate timely access to quality healthcare without the threat of loss of income or employment.
That we need a robust and resilient health systems in place, and that we need to build capacities in readiness for such eventualities.
Do whatever it takes to get data and keep it.
COVID-19 pandemic has been a lesson in the importance of having universal health coverage and a resilient health system.
You have to raise awareness and say, stay your home and save the people. If you want to be safe, save the others.
Governments should prepare a channels to deliver health information to their countries or to their populations.
Everyone should have some basic medical knowledge so that rumors regarding pandemic do not affect them.
Misinformation can be just as dangerous as a disease.
Still, we need to fight hardly fake news and also disinformation. Together we can make the difference.
Government should have accurate public health policies and a strong healthcare system to avoid more patients and health providers' deaths.
We are only as healthy as the least insured person in a society, so we have to strengthen our health systems.
The lesson I learned from this pandemic is to not be complacent. No matter where you are in the world, it's important to invest in your healthcare and your public health systems.
We should invest more in the community awareness about our health system, but also build a strong and self-reliant health systems.
COVID-19 reminds us that disease knows no borders, and that there is an actual pressing need for universal health coverage and strengthening of health systems globally.
Surgery that neglected is stepchild of public health is more neglected during the pandemic. Lack of surgical care increases. Operation theaters are shut down in many places.
In response to the outbreak, surgeons have been forced to shift from the patient-centered ethics to public health ethics.
Not only is an adequate supply of PPE important, but being able to use it properly and resourcefully is equally as important.
A lesson I learned from COVID-19 is the importance of telemedicine in providing routine prenatal care. Telehealth should be utilized as a resource during this time because it mitigates the spread of COVID-19 and also provides pregnant women access to their OBGYNs.
The COVID-19 pandemic has taught us how we can take down geographical and financial barriers faced by our patients and colleagues in low-resource settings.
Universal healthcare access, including surgery, should be available to all.
We are calling to provide surgical care more affordable to patient need.
Health equity is the key to overcoming a pandemic.
We have to think about those who doesn't have access to care, to health systems, and make everything we can to treat them as equally as possible.
National surgical crisis planning must become part of every health system's lexicon.
That we should strive for health equity, especially during these times of pandemic caused by COVID-19.
Many countries across the world are in the lack of intensive care units.
We put a lot of effort into mass destruction weapons instead of medical equipments. Thank you.
Shortage of PPE, ICU resources, and ventilators across the world has taught us the importance of strengthening surgical healthcare systems globally, as well as the universal health coverage.
I think one of the biggest things I learned from this pandemic is how we need to be more efficient with our resources.
This pandemic has brought a unique opportunity to come together and bridge gaps. We must keep our efforts as ongoing processes that go beyond these difficult times.
From COVID-19, I learned the importance of interdisciplinary collaboration and to develop surgical crisis plan beforehand to deliver safe and effective services.
A global collaboration between physicians, health policymakers, trainees and medical students is so important and so much more necessary now more than ever in advocating for universal healthcare coverage.
Global solidarity and collaboration, as well as interdisciplinary cooperation, is very important in tackling crises such as this.
Now more than ever, we need to find innovative ways to have partnerships in order to attain universal health coverage, especially with regards to ensuring universal access to surgical health care.
One of the lessons I've learned during this pandemic is the importance of multidisciplinary collaboration and supporting each other during these difficult times.
COVID-19 has led us to understanding that there's a lot more that can be innovated, a lot more that is to be discovered, whether it's in surgery or any other medical field.
But in these difficult times, do not lose hope, and instead of complaining about problems, try to look for the solutions.
What I learned during this COVID era is the importance of conducting research even in a time of crisis.
We live in a small world and we need to fight against all diseases and causes of morbidity and mortality.
Mental health matters, not just for the infected, but also for the affected, and especially for the frontline workers. So let us try to be there for one another.
Know yourself better for a better future.
In the midst of the pandemic, we observe how it makes a difference in people's life and cannot be overlooked.
No one should be left out. We need stronger health systems globally.
It's time to show solidarity and unity.
What we need is unity. To beat this invisible enemy, we have to work together, we have to stick together.
COVID-19 pandemic reminded us of human solidarity and how united we should be in achieving unique goal, providing affordable care for everyone in need anywhere in the world.
The health of anyone anywhere is the health of everyone everywhere.